Dzień dobry, drodzy koledzy, bardzo dziękuję za możliwość uczestniczenia w tak autorytatywnej konferencji. Zwłaszcza wdzięczność do mojego bliskiego przyjaciela, którego znamy od 10 lat, Andrzej Grzybowski. Obiecuję nauczyć się zaśpiewać piosenkę Cha-Cha na naszej następnej konferencji offline. Let me pass to my presentation. It's a comparison of visual function and degree of satisfaction with the vision quality in patient after implantation of diffraction-refraction and refraction intraocular lenses. Multifocal intraocular lenses are increasingly used in surgical practice in the treatment of cataract and refractive lens replacement. The structural feature of multifocal IOL create the development of undesirable light phenomena, the most common halo, glare, flare, and crescents. Refractive lenses use zone with different refractive power to achieve multifocus. The quality of vision provided the refractive depends on the side of the pupil, the location and number of refractive zones. Diffraction lenses are based on the principle where each point on the wavefront can be source of secondary waves, Huygens Fresnel principle. The phase difference of the elementary secondary waves arriving at the observation point leads to their mutual application. Now we can see the comparison refractive and diffractive lens simulation in Zamax. On the up, this is the diffractive and down refractive lens. The lens comparison, diffractive lenses, it's excellent reading and reading vision, difficult in working with the gadgets, discomfort when working with a computer, and less dependent of pupil size. For refractive lenses, superb medium and long range vision, inability to read small text, fatigue during long work, and pupil size dependent. Combined lenses have both a diffractive element and a refractive element. In typical diffractive lenses, one of the surface is monofocal, refracting smooth, and fine structured. Annual relief along the radial direction is applied to the other surface. Trifocality is achieved exclusively by modification of the main and the phase zone at 8 Lisa. 8 Lisa tree consists of different phase zones in event and odd zones. Lisa's abbreviation of the 4 unique principles of this IOL: asymmetric distribution of light, independence from the pupil size, SMP technology, which allows to obtain ideal image quality in low light condition, twin line vision, and aberration correction due to optimized spherical optics, providing increased contrast sensitivity, depth of focus, and visual acuity. Uses enlightened technology, Panoptics uses enlightened technology, enhanced light energy. A high degree of use of light with a pupil diameter of 3 mm is possible to deliver 88% light flux to retina. And opposite diffraction multifocal optics. Biflex, elevated fast shift technology, 7 concentric diffraction steps which are located in the central 3.0 mm zone of the optics, intermediate peak for intermediate vision. Now you can see the slides where we compare all kinds of the lenses. The study was conducted at the premises of the communal enterprise Dnipro Regional Ophthalmological Clinical Hospital within the period between January 1 and July 1, 2018 and 2019. The list of patients included 45 persons at 90 eyes at the age from 33 to 82 years who met the criteria of inclusion, in particular the binocular implantation of intraocular lenses of mode aqueous panoptics A Lisa and B flex, absence of severe medical pathology including autoimmune disease, as well as absence of coexciting eye disorders which may influence of acuity of patient's vision in the postoperative period. A unified quality of vision questionnaire was chosen, which makes it possible to evaluate 10 frequently occurring symptoms according to 3 criteria: symptoms frequency, severity, and bothersome. It is suitable for measuring subjective satisfaction with the quality of vision in patients with all type of refractive vision correction. To illustrate and exclude the influence of the researcher on patient's answer, the questionnaire used illustration of dysphotopsia like halo, starbirds, glare, distortion, hazy vision, blurred vision, and double vision. 45 patients, 90 eyes, aged 33 to 82 years, who fit the inclusion criteria were included. The mean actual length of the eye was 23 millimeters, UCVA 0.21 or 20/100. Patients report the most frequent dysphotopsia, glare, hosting, and visual impairment in the evening. Glare and halo more often occurred under mesopic condition, as reported by 26 patients, 57%. 3 patients, maybe near 7%, consistently resort to spectacle correction. Visual acuity above 22.5 at near 30 centimeters and far 5 meters foci was observed in 41 patients, 91%. At a distance of 80 centimeters, the average visual acuity was 0.6. Now you can see the slide. The A Lisa lenses demonstrate excellent result in the near 0.9 and the far 0.93 focuses, and smooth decrease to 0.6, the distance of 80 centimeters. B-flex lenses show excellent results in near 0.9 and far 20/20. Distance in the intermediate range of 60 centimeters is 0.76. The smallest visual acuity of 0.65 is observed at a distance 40 centimeters from the eye. Panoptic lenses showed a competitive result at close 0.87 and far 0.95 distance. A more pronounced dispersion of the result at the distance of 40 centimeters is 0.75. At a distance of 80 centimeters showed a decrease in visual acuity to 0.6. B-flex at an intermediate distance of 80 centimeters showed the best result. Visual acuity of close and far distance is close to reference. The frequency is occurrence was aqueous self-panoptics 64%, 50% rarely, 40% often, and at least 43% really 14%, and 21% often, and 7% very often, and biflex 53%, 47 really, and near the 6% often. The strongest manifestation was recorded in 1% from the 8 ELISA group, it's a 7%. Then sensitivity of the weak manifestation and higher was aqueous of panoptics, near 42%, 33%, and 35% low intensity and 7% moderate. At ELISA, 35%, 40% weak intensivity, and 7% moderate, and 14% high intensivity. And biflex, 11% minor manifestation. The strongest manifestation since it was observed in the group with at ELISA, 14%. Irritation is present in 50% aqueous of panoptics, namely 42% of respondents. Respondents noted mild irritation and 7% very severe irritation. At ELISA, 21% and biflex 35%. The incident rate was 78% aqueous of panoptics, 35% rarely, and 42% very often. At ELISA 71%, 21 rarely, and 50 very often, and biflex 74%, nearly 75%, 35% rarely, and 30% very often. A high degree of intensity is noted by 15% of respondents. Aqueous of panoptic 40%, and at ELISA 35%, biflex, none of respondents know the high degree of intensity. Irritation aroused only 30% of respondents. Severe irritation in aqueous of panoptics was 28%, at ELISA 35%, biflex had a total irritation 23%. The mild irritation may be near 6% and 70% severe. Visual impairment at dusk was observed in 64%, rarely 57%, often 7%. In the panoptics group at ELISA, impairment of vision occurred only 42%, biflex vision impairment occurred 56%, 11 very often, and 47 rarely. The intensity of the panoptics group is 21%, 7% in all 3 degrees of manifestation. At ELISA has a low intensity, 21%, and a moderate intensity, 7%, and near 6% of respondents biflex moderate intensity of vision loss. Visual impairment at dusk is of little concern, since it has a small degree of manifestation. In the panoptics group, this worried 14% of respondents. At ELISA, 14, the same one, and the 7 almost did not bother, and 7 minor concerns, and biflex just only 6% of respondents moderate intensity of vision loss. The diagrams show that the larger and zoning of the lens, the more it becomes dependent on the diameter of the pupil. Panoptics 42% say that after surgery the operation has to use spectacle correction, 35%, sometimes 7% often. At ELISA 36%, 28%, sometimes 7% often. Biflex 35%, 30% sometimes, and 5.9 near the 6% often. The level of overall satisfaction was usually considered by ranking all the answers. They contain their number. Now you can see the level of satisfaction. Displace it, rather satisfaction, satisfied, very satisfied. Conclusion. The ultimate of the lenses provide close to reference visual acuity at different distance. The presence of glare and housing is more pronounced in diffraction lens aqueous of panoptics and at ELISA. The share of visual acuity is subjective satisfaction was 30%. Biflex combination lens show the best visual acuity and subjective satisfaction. When you choosing multifocal lenses, one needs to take into account the psycho-emotional status, profession, and lifestyle in each case. And then everything will be fine. I would like to thank for everything, for everybody, for attention from our team. Thank you.